Breaking the stigma. Ahead on Face the State. The state rolls out a new license plate in an effort to raise awareness about mental health, but much more is going on to help Ohioans in crisis. Department of Mental Health and Addiction Services Leanne Cornion on the initiatives to reach people when they need a lifeline. Plus,
in our everyday life, everybody deals with mental health. And building up this resilience is a much different perspective than talking about suicide and overdose.
Ohio State head football coach Ryan Day on changing the conversation around mental health and why it's a very personal passion for him. And state Democrats call it a budget of broken promises, what they want to change as the state budget process moves forward. Senate Minority Leader Nikki Antonio lays out their priorities. Face the State starts now. Thanks for joining us for Face the State. I'm Doug Petcash. May is Mental Health Awareness Month. The state of Ohio has several initiatives to help those in a mental health crisis and those who may be considering suicide. Mental health is a huge issue here, and the number of people struggling with it may surprise you. According to the Ohio Department of Mental Health and Addiction Services, 1 in 5 adults live with mental illness. 1.8 million live with a substance use disorder. The 988 Suicide and Crisis Lifeline is one of the critical resources for those in crisis. Since its launch in July of 2022, Ohio's 19 call centers have responded to nearly 540,000 texts, calls, and chats. The average, 19,500 per month. And 99% of those contacts are answered by Ohio-based responders. To help raise awareness, on Tuesday, state leaders unveiled a new specialty license plate featuring the 988 Suicide Crisis and Lifeline logo. For each plate sold, $25 will go to the Ohio Suicide Prevention Foundation to support local suicide prevention initiatives. Governor Mike DeWine says his goal with this license plate is to raise awareness that there is a lifeline for people in crisis.
We know that this number saves lives. The fact that people who call 988 in Ohio are talking to a fellow Ohioan, but also someone who has been trained in this area. The fact that we then can tie that person in to all kinds of different services in their local community. This is just an invaluable number.
You can buy a 988 license plate at deputy registrar locations and online at bmv.ohio.gov. Joining me now to talk about mental health initiatives in the Buckeye State is Leanne Cornion, the director of the Ohio Department of Mental Health and Addiction Services. Director Cornion, thank you for being here today.
Thank you so much for having me.
Well, so let's start with this. Why is it so important, and how important is it to have a month dedicated to mental health awareness?
Well, as you said, mental health is prevalent. Mental illness is prevalent across our state and across our nation. So having a month fully dedicated to raising awareness, to educating Ohioans about the signs and symptoms of mental illness, and helping to break down stigma is critically important. We know that 2.2 million Ohioans struggle with mental illness every single year, and we want everyone to feel like help is available and help is out there, and it's okay to not be okay and reach out when you need assistance.
How would you characterize the situation with mental health? Is it getting worse, or is it getting better? And I guess the more people you hear from, that means they're reaching out for help.
Well, we know we've done a great job addressing stigma through the governor's real initiative with Beat the Stigma. We've really helped elevate the prevalence and the awareness of mental illness in Ohio. And more individuals are reaching out for help, but we also know that people might be a little bit sicker today than they could have been in the past. And that's why it's so important that we create a lifeline like 988 so that more Ohioans, every single Ohioan, has someone to call when they need help.
What would you say is the key initiative in the state for helping people in crisis?
Well, certainly 988 has been a huge lifeline for Ohioans who are struggling with thoughts of suicide, but really just everyday issues. Maybe it's a breakup, maybe it's financial stress, maybe it's the loss of a job or a conflict with a family member or loved one. any crisis, as the person defines it, is a great reason to call 988. And as you mentioned, more than 500,000 calls, texts, and chats in the 2.5 years since we've launched this.
And who mans those phones?
We have 400 trained professionals all across our state at 19 call centers. We actually have the most call centers of any state in the entire nation. And we want to make sure that those call takers know the services and supports in their community. So when that person picks up the phone and dials 988, we're able to connect them into the services and supports right in their backyard.
I think we've all probably seen the ads that you referred to, the Break the Stigma commercials that are on TV, online, on the radio. But now, with the rollout of the license plate, which we can show again here, another tool to raise awareness. How important, or what are your hopes for the license plate?
Well, first and foremost, we just want more people to know that 988 exists. When we surveyed folks in 2023, about 36% of Ohioans knew that 988 existed. Now, that's double the national average, but certainly not where we want to be. So having license plates on hundreds and thousands of cars driving on our roads every single day certainly is making a connection with someone who doesn't know that 988 exists.
And then there's the financial side of this too, because I believe it's $25 from every plate will go to the Suicide Prevention Foundation. So how much will that help, and then how is that money used?
Well, the Ohio Suicide Prevention Foundation is an excellent partner of ours at the Department of Mental Health and Addiction Services. We work with them incredibly closely to ensure that we're infusing suicide prevention programming all across our state that's relevant to our highest risk populations. So any additional resources will help us expand those programs so we can reach more individuals and prevent our suicide rates from going up.
In April, you and the governor announced that the state is expanding it's called the Mobile Response and Stabilization Services, MRSS for short. Under this program, trained and certified professionals are deployed right to a child's location within 60 minutes or less. First of all, why do you believe that a response like this is critical?
Well, if you've ever known someone or personally experienced a child having a behavioral health crisis, it is really difficult to know what to do. You can take them to the emergency department where you may face long wait times in an environment that's really not therapeutic for that child. So having trained professionals to respond right to that child's home where they can deliver care in a safe and comfortable environment is game changing for our kids. And having this in every single county, every single family with a child facing a behavioral health crisis, having help no more than 60 minutes away, it's truly life-changing for our state.
And it's not just going to their home, right? It's going to wherever the child is. It could be at school. They mentioned like at the playground, at the park as well, right?
Absolutely. We've heard stories of MRSS responders going to libraries, to schools, to emergency departments even, to parking lots, to the side of the highway. It's wherever that child is when they're in a moment of crisis, they'll respond if it's a safe location.
And also, it's not just that critical incident response too. There's follow-up as well. I believe it's like 6 weeks of follow-up, and it's free.
Completely free. What's so unique about Ohio's model is that no family will receive a bill for these services because we want to ensure that that is not a barrier to individuals seeking out help. And you're right, it's up to 42 days of ongoing services and supports to help that family stabilize right in their home and community.
How would those teams be deployed? Is it through 988, through 911? How does that get kicked into action?
So we are integrating our 24/7 MRSS hotline into 988. So any family who's in need of MRSS services can pick up the phone and call 988, and our incredibly well-trained call takers will help to dispatch those mobile response services.
Also, just recently, the Franklin County Crisis Center opened. How critical is that going to be in meeting those immediate needs?
Absolutely. We say at Ohio Moss that we want everyone in Ohio to have someone to call, someone to respond, and somewhere safe to go. And that crisis center is that last piece. It's that somewhere safe to go. If they can't be stabilized through 988, if they can't be stabilized through mobile crisis services, they may need a higher level of care, and that's exactly what that crisis center provides.
What would your final message be here as we get towards the end of May? Obviously, the awareness stuff doesn't just happen in May. What message would you want to leave people with?
That 988 is 24/7, it's completely free, it's totally confidential, and it's a crisis as defined by the caller. As I said, you don't have to be contemplating suicide. Life could just be feeling a little heavy and you may need someone to talk to and process that with. So it's okay to not be okay, and there is always help out there when you need it through 988.
Director Leanne Cornian, thank you so much for this perspective today. Appreciate it.
Thank you.
And keep raising that awareness, right? Thank you so much. And once again, if you or a loved one is struggling with thoughts of hopelessness or suicide, you can call or text 988 at all hours of the day to talk to someone. Still to come on Face the State.
Well, I think the stigma about talking about mental health or saying maybe I need a little help in this area or I'm struggling was a sign of weakness. It's actually a sign of strength.
A new national champion on being a champion for mental health. Why Buckeye head coach Ryan Day shines a spotlight on it. But next, public schools, childcare, Medicaid, and more. What Democrats are fighting for as billions of dollars in state funding are being hammered out. The clock is ticking for state lawmakers to produce and pass a 2-year state operating budget. The House passed its version, and now the Senate is working on it. The General Assembly has to present a final budget to the governor by June 30th. Last week, Senate Democratic leaders held a news conference to lay out their priorities and amendments for the budget, which is House Bill 96. Democrats say they have submitted more than 400 amendments to the proposed budget. They outlined 4 key areas of interest. They want to make sure the budget provides property tax relief that does not undermine public school funding, protects Medicaid, supports child care programs, and fully funds food banks and libraries for Ohio communities. Joining me now to discuss the Democrats' budget priorities is Senate Minority Leader Nikki Antonio of Lakewood. Welcome, Senator.
Thanks. Good morning. How are you?
Good morning. I'm doing well. I hope you are as well. So 400 amendments tells me there are many things the Democrats don't like about the proposed budget. So what's the key thing that you want to change, Senator?
Well, I think you identified it in your introduction. Truly, it's the fair school funding formula is at the top of mind and top of our list as a priority. I think everything else is hinged off of that, absolutely, for our communities, for our kids. And what my caucus is very concerned about, Democrats are worried that this budget would be passed on the backs of our children and our communities and our public schools rather than making the case for other priorities.
Well, now that the U.S. House passed a budget proposal that would cut roughly $700 billion from Medicaid, do you worry the same will now happen in Ohio?
Well, we're very concerned about that. And let's be clear about Medicaid. First of all, in the state of Ohio, Medicaid pays for 50% of the children who are born in the state of Ohio are born to moms who are covered by Medicaid. And then Medicaid covers their lives, their health care for the first 3 years. At least it has up to this point. If we are truly concerned about infant vitality, we happen to have one of the highest infant mortality rates in the country, then we would want to do everything we could to make sure that children, those babies, have access to health care in those critical first years of their life. So Medicaid, top of mind. As far as the expansion population that's now covered under Medicaid as well, these are working Ohioans, sometimes 2 and 3 jobs. You know, this idea of a work requirement, they're already working to even qualify. And Medicaid makes it possible for them to have maintenance health care so that they can show up every day for their jobs and be productive. I truly believe that if Medicaid is cut in the state and in the country, it is going to the change and the effect on the workforce is going to be something people are not even thinking about, but will be shocking. We also fear that what it'll do is make some of our, especially rural hospitals, close because they won't be able to provide the care, getting the support that they need. Their uncompensated care will go through the roof. And it's going to leave folks in all kinds of areas throughout the state of Ohio without access to health care, whether they have Medicaid or not. And hospitals are really going to bear the brunt of this. Right now, we have been able to use emergency rooms for emergency services. If Medicaid is cut, people are going to start going to the emergency room like we saw before for their everyday healthcare needs. They're going to wait longer. They're going to be sicker. It's going to cost more in the long run. This is very short-sighted. And what it shows me on the national level is that the people that made this decision know nothing about our healthcare system and know nothing about public health at all.
Senator, you mentioned education funding. Right now, the Ohio House budget proposal puts a cap of 30% of operating budget that school districts can carry over to the next year. Anything over that, they would have to give back to property owners as tax relief. Does that idea have support in the Senate, and are Democrats trying to amend that?
Democrats are definitely trying to amend that. That is a non-starter for us. I've heard from a lot of school districts. Look, this is a policy that, I don't know, it came from the House, but it actually punishes school districts for doing their job, and they're required, according for their bond ratings, to be able to have at least 25% cash reserve. So even this idea that somehow we would punish them and that we would put the blame of high property values on the school districts rather than where it belongs, which is on the legislature for failing to act, is a non-starter for us. Conversations going so far show us that there is a concern as well with my colleagues in the Senate, my Republican colleagues, and I believe we will have a different proposal than what came over from the House. I'm not quite sure what it's going to look like. My colleagues and I prefer not to cap them at all, but to tell each of the school districts to have policy in the school districts that says you decide on a policy for both transparency and accountability, but the legislature shouldn't be dictating to the school districts what that looks like.
So what do you make of the proposal to provide $600 million in bonding for the Cleveland Browns owners to build a new stadium?
Well,
you represent that area.
I do. I do not think that's the answer for how we go forward with supporting our sports teams. I'm all for supporting our sports teams, but not this way. First of all, that $600 million is close to, it would take about $720 million to fully fund the Fair School Funding Formula. I've been told by Republican leaders early on in the budget process that the Fair School Funding Formula was not sustainable, and yet the House sent us a budget that had $600 million for billionaire owners to enrich their franchise and move the Browns out of Cleveland into a suburb, and at the expense of the city of Cleveland and really cannibalizing dollars there in the city of Cleveland. So that proposal has a whole lot of problems. I'm hoping, and I know it's been tough, that gets worked out. But the legislature should not prioritize giving billionaires money for their franchise over the children of the state of Ohio. My colleagues and I prefer to prioritize our children and our local communities first.
Senator, we just have about 15 seconds left. What are you expecting from the next 5 weeks as this gets hammered out?
I'm expecting a lot of conversation. I hope it's productive. I think the bottom line is we need a budget that works for everyday Ohioans, not millionaires and billionaires. And I'm hoping that that is reflected, that the state of Ohio prioritizes our hardworking Ohioans over those well-connected and wealthy folks.
Senator Nikki Antonio, the minority leader, as always, thank you for your time today. I appreciate it.
Thank you.
Well, straight ahead on Face the State, bringing dark times into the daylight. Why Buckeye head coach Ryan Day is on a mission to break the stigma around mental health. Mental health awareness is a cause very close to Ohio State head football coach Ryan Day and his wife Nina. Ryan often uses the metaphor of a river to talk about mental health and making sure those struggling get help upstream. Over his career, Ryan and Nina have become a bridge for so many, with a major focus on the fight against the stigma. 10 TV's Adam King sat down with the Buckeye head coach.
The trophies reflect his biggest wins.
One reason you get into coaching is to have an impact on young people.
But one of Ryan Day's largest impacts isn't in this room.
A lot of areas to unpack when it comes to mental health.
It's showcased here and shared here.
Told me they were scared, told me they missed their friends.
A family now national champions, always a champion for mental health.
I think the stigma about talking about mental health or saying maybe I need a little help in this area or I'm struggling was a sign of weakness. It's actually a sign of strength.
Day has shared the stories growing up dealing with the loss of his father to suicide.
I think when people hear mental health, and it really happened to me a lot when I first came out with the story about my dad, was like it got heavy. But that's all the way down the river like we're talking about. Like, let's talk about getting to the point where, you know, if there's something that needs to be addressed, it's treated the right way. In our everyday life, everybody deals with mental health. And building up this resilience is a much different perspective than talking about suicide and overdose.
That word, resilience, it's a major part of the family's focus.
The resilience that our team had to show, you know, some people talk about if we didn't go through the losses we did, would we have accomplished what we accomplished? I still say yes, but I don't think it would have been as dominant. You know, we had to come out the back end of it, but that's just life. And so the more that we can talk about this resilience, I feel like the more that we all understand it, the more we can battle this thing.
The Days have the Resiliency Fund, and along with the Kids Mental Health Foundation, they've donated millions for the next step in mental health.
It's the access part of things and understanding that there are different levels to where we are on this river. And certainly we all see the extreme part of it down the river, but where are we at in the rest of this journey in mental health? And so having the facilities, having the access is going to be critically important, but also just the understanding of where we are in it all.
They share that importance in speeches, in the foundations, but it also shows inside the Woody every day.
I think for our guys to see, you know, the stance that Nina and I take publicly and my family in this mental health space allows them to realize that, hey man, like this is not a sign of weakness, but knowing that it's okay to ask for help and get help, and it's only going to make you a better football player and then eventually a better dad and husband.
The Days don't do it for the applause, but every day the importance of their message shows in Columbus.
The amount of money and time and the spotlight that you've given to mental health, has it ever hit you that you and your family have likely changed, maybe saved hundreds, thousands of lives?
I don't really think about it a lot, but when we do hear the stories of players, some of the stories which you know, the public knows, many of which you don't know. I mean, I got a call the other day that took me off my seat from a parent of somebody who's not in the program anymore, and just talked about how, you know, we saved their son's lives or their life, and it was just one of those moments where you're like, yeah, this is why we do what we do, because you know that's why you get into coaching.
You can watch Adam's full interview with Coach Day right now on 10 TV Plus. Download it on your TV and watch for free. Thank you for joining me this week for Face the State. I'm Doug Petcash. We'll see you back here next Sunday at 11:30.